Welcome everyone. My name is Steve Mombach and we're proud to be giving a TriHealth Facebook Live session for skilled nursing homes and home care. I am our Senior Vice President of Ambulatory Care. I have been with TriHealth for 17 years. I have been in the skilled nursing industry prior to that for over 20 years. We're thrilled you could join us today, and we're really proud of our relations that we have with the nursing homes out there. As many of you know, TriHealth has had a long-standing commitment and relationship with our post-acute providers. Over the past 20 years, we've had educational events and symposiums, and through the last 4 years, we really have updated that to ensure we are communicating on a regular basis, sharing best practices in healthcare, and that's been provided by Lori Baker and by Barb Dam. We also have learned a great deal through these conversations. We appreciate the ongoing collaboration and mutual focus on your residents, many of our patients, and their families to ensure that we truly give the best possible care as we serve together in Greater Cincinnati. The past 3 months have certainly been challenging for all of us, and the community really has come together and have worked together, and hats off to the healthcare collaboration that have brought together our local hospitals, skilled nursing facilities, and home care organizations to ensure that we're all learning and adjusting to the challenges that have been presented with COVID-19. Our sincere appreciation to Dr. Richard Shunk, the Health Collaborative team, and all the local industry leaders that have done outstanding work in keeping everyone organized and proceeding ahead for what could come. TriHealth wants to spend the next hour or so answering questions that many of you have already submitted. So we're so appreciative of our two physicians that are joining us today. Dr. Kevin Joseph is our Senior Vice President and Chief Medical Officer for TriHealth, and Dr. Stephen Blatt, who's our System Chief for Infection Disease. Both are participating with this live event, and we're just thrilled to have you both here. The next group of questions is about PPE. Protective equipment that our staff should wear. And the question is, and they want to comment about the N95 or equivalent mask, what's better, what about gowns, gloves, face shields, and I really am, and I want to say this for our organization, really proud of our organization that we've been able to donate a lot of equipment that nursing homes have and home care have needed. Our team has done terrific that way, and we will keep doing that for the community. But comments on, I think there's a concern, I have to have an N95, the only way I should do it, and we know there's some misnomer on that. So I'll ask one of you Dr. Blatt, maybe for you to comment on that one.
Okay. Yeah, so when you're caring for a patient who's known to be COVID positive, especially during that first 10 days of the infection when we think they are able to transmit the virus, if N95s are available, that's great. Regular surgical masks are also very, very effective in preventing transmission from an infected person to a healthcare worker. N95s are slightly better, but certainly not 100% better by any stretch. There's a slight reduction by using an N95 mask. Gowns and gloves, especially when you're doing on-site direct patient care, as well as a face shield or some kind of eyewear to prevent transmission into mucous membranes like the eyes are essential as well. And so by using that kind of personal protective equipment, we've been very effective in preventing transmission to healthcare workers. And so I think if those kinds of PPE are available, healthcare workers can be very confident that they're not going to pick up the virus from an infected person.
Great. Go ahead, Dr. Joseph.
Another thing in terms of perspective, so the CDC, as Dr. Blatt stated, recommends that healthcare providers, when they're working with a patient who is COVID positive, to wear the face shield and the gown and the mask, but it's just a surgical mask. And as a provider myself, when I'm with a patient listening to the chest or in the side of the throat, I am just a foot or two away from the patient. And the CDC still only recommends a surgical mask. So someone just around the room wearing a surgical mask, the chances drop dramatically whether you're going to catch it. And another precaution you can take is when a provider is in the room of a resident or a patient, have the resident or patient put on a mask, and that will help out as well. And as Dr. Blatt stated, if you do have N95s, this is just another layer. And so each layer of protection does add further, but really what is needed by the CDC is just a surgical mask and then something to cover your eyes.